progressive journalism, like, share, and subscribe to our YouTube channel. Don't forget to press the bell icon for latest updates. Hello and welcome to Salar. I'm Dardana Simran, and today we'll be discussing about the Zydus Cadila vaccine. In August this year, the Drugs Controller General of India approved this vaccine for emergency use authorization for use in adults and children above 12 years. Giving us more details about the vaccine and its importance, joining us is Dr. Ravindra Mehta, who's an established clinician, researcher, and teacher in the field of pulmology. He has an extensive academic training and professional experience both in India and the United States of America. Thank you, Dr. Mehta, for doing this.
Thank you for calling me.
So let's jump right in. And I want to ask you, the first off question, which is in people's mind right now. What type of vaccine is Zydus Cadila?
So it's the first of a new generation of vaccines. And the most interesting part is that COVID keeps on reinventing the space, both from the virus point of view and the treatment and the prevention point of view. So as a change in the way we approach vaccination has come this vaccine. It's based on a DNA principle. It's called plasmid DNA. Here's where I get a slightly complicated and hope I don't lose you, where the old vaccines used to be either an mRNA carrier, which we're very familiar with, the Pfizer and the Moderna. Then we had the whole vaccine constructs, which is our Covaccine. Then we had the adenovirus, a certain other virus which carries the protein subunit, which is the Covishield or the Oxford AstraZeneca. Here, a DNA fragment will take the virus element, go through the skin, present it to the body cells. The body cells now make the protein, which is recognized by the immune system, and the immune system says, this is what I have to target. So it is an indirect way of presenting the virus using a form of DNA to the immune system. So the immune system reacts and produces antibodies, which we want. So to keep it very simple, we ultimately have to activate the immune system. And this is a different way using a DNA method to try and activate the immune system to get the desired immunity or strength to fight the virus when we get later infections.
Right. And of course, there were so many variants that came in, and currently also there are different types that keep coming every day, right? So there are different vaccines in the market, which you just spoke about. But if you could just tell us a little more in detail as to how is this a little different so that our audience can understand that. Because, having said that, you were one of the investigator for the Zydus vaccine. So I'm pretty sure you can come up with, a brief as to what exactly is different about this.
So the difference is the technology used, and it can be looked at like for lack of a better example, like cell phones. Ultimately, you have Samsung, you have iPhone, you have so many out there. Ultimately, what do? They may help you to receive a call, make a call, and have a smartphone function. Similarly, vaccines use different modalities to try and deliver the virus so as to activate the immune system. So to repeat, ultimately, their modalities to deliver the virus so as to activate the immune system. This is a different method. Why is it different? Well, it's proprietary, it's DNA based. What they claim is that because of the DNA, it's easy to change it. Because down the line, we not only are going to be happy with the vaccine, we're going to demand and say, we want a second generation vaccine. We want the third generation vaccine with all these mutants we talked about. So in such a situation, this construct allows new generations of vaccines to be produced without much difficulty.
Okay. And I think, this is a very easy way that you put it out, giving the phone example, because if a layman has to understand this, then we know that at the end of the day, any vaccine is doing its job. But of course, there are different ones for us to choose, and that kind of helps, right? But having said that, I want to ask you that there is the Zydus Cadila that we've heard of, but there's also Covaccine that has been approved. So what is the difference between the two, and which one would you personally recommend?
Right. So we're basically inspiring and I think increasing the biology quotient of our general viewership, where we are trying to say that different constructs come in. So the Covaccine construct is the whole virus construct. You take the entire virus, the bad fellow, and you basically inactivate him and put him into the immune system. The immune system recognizes him and then tries to increase the immunity. That is the way the whole virus construct works. These
Right.
other virus construct, the other constructs are different. So Zydus Cadila here has a DNA construct. As we said,
Oh,
the Covishield guys have got different construct. The mRNA construct, which is in the US, is another construct. So it's very much analogous
correct.
to what we said. Our job is getting done by different vaccines. Now I'll add a question. Why is it important to have different constructs? Because each one may have pros and cons down the line. If one construct doesn't
Right.
work, at least you have three others. Secondly, for the first time in the history of the world, the entire earth we're trying to vaccinate. In such a
Mhm.
situation, as many has come on the ground, especially with the changes, the variants, and the large population, would be useful.
Right. So, having said that, because there are so many, different types of vaccines that also came out, and rules were also changing, with time, right? So first, that we knew that we had to get as adults that there were two doses that were given, and then there was a new rule that okay, a third dose would also be more beneficial, and there was another study that came out that different mixes of vaccine were also being proved beneficial. So asking you about this vaccine in particular, how many doses would it require to complete a vaccine cycle?
So as per the original thought process, so every vaccine, when you go through both the conception, evolution, and trial, you need a thought process. So as per the original research and scientific thought process, the doses envisaged for this vaccine is three doses. So it's
Okay.
0, 28, and 56, literally, 0, 1 month, and 2 months by and large. And that's
Okay.
not something intuitive. It's based on the scientific model of the projected efficacy when you use such a construct. It's the way it is.
Correct.
Initially, when it came, we thought three doses may be a lot. But I think when the second wave has hit, it has become very clear that maybe it's not the number of doses, it is which vaccine on the ground will be efficacious, will be safe, will be covering a larger population, and which can be reconfigured if the mutants come in down the line so that this fight against COVID-19 goes maturely.
Right. And I think that makes a lot of sense because you also have that choice to choose which one that you'd want to, take and see, because you've heard a lot of other people in the surrounding also pick up. So, having said that, I want to ask that this is a vaccine that you said it's a different in the market because it's DNA based, right? So, could you explain what is the needleless method that is used in this vaccine? Because it's different and it's a vaccine that is mostly for kids and it's for children. So how is it different than the others in terms of the needleless method?
Right. So to walk behind on your kid comment, it's actually 12 to 18. So it's approved for adolescents right now because they were part of the trial. And it was the first one which came from India to get approved for the adolescent population. And of course, Pfizer in the US also is approved. To
Right.
add to your second point was the fact that yes, many are required because we don't know what's going to come into our country or the rest of the world. For the first time, we're talking this should be a global endeavor. Sitting in your country and vaccinating only your people is not going to work. So we're lucky that we have at least three or four constructs with us at this point. Now, to actually answer your question on the needleless thing, they use the technology called PharmaJet. PharmaJet is
Okay.
easily available on the net in case people are more curious. But to make it simple, it's a delivery system which actually you put the vaccine product in between the layers of the skin. It's called intradermal. Intra means within, dermal is skin. That's the easy way of explaining some fancy medical lingo. So it's put over there, and because of the pharma jet method, it actually puts a little pressure and the thing goes over there. So it
Okay.
does not require a needle at all. So it is classically given, in the shoulder area over there. So pain is understandably less because there's no needle prick. Delivery is simple, it's disposable, it cannot be reused by and large, and quite easy, user friendly, and not difficult to teach. So by and large, these guys have had these three unique things. One is the construct, second is the delivery mechanism, third is of course the fact that three doses are required, and fourthly they managed to get an early approval for the adolescent population.
Right. And I think it's also come out at a time where, most schools are reopening. And in fact, yesterday, the state itself has announced that from October 25th, schools will be mostly starting off, right? So having said that, but there are still a lot of parents that are apprehensive about sending their children to school. So do you think we should wait till, every child is vaccinated to reopen the school, or, take like a shot at getting the children back to school, but being more precautious with in terms of how the maintenance is done. What is your take on it?
So there is guidelines, then there are global policies, WHO policies, Indian policies, and ultimately what parents will do.
Right.
All the different things. The guidelines say that you obviously can't wait for vaccination. I mean, if you look at a country like India, we have 30% of our population as less than 18 years of age. And a significant number must be in the school growing group as a subset of that. So are we going to wait for all that? That will take another God knows how many months, with all the detriments of missing out education for those who are not able to get online, or the negatives of online. So to
Right.
answer your point, by and large, the guidelines or recommendations, which is also a personal take, is that when COVID is at an all-time low, a reasonable point of reasonable population of the adult population is vaccinated. We understand the disease in children better. We put enough measures in schools, and we are able to keep the disease at a low level with the plan B, is the time to start schools. So that's already started. I mean, different
Yeah.
states are functioning at different levels, but in the state of Karnataka, already I think at a certain classes are going, and when we were reading that, I think 5 years and above also they're very keen to start.
Yeah.
So I think based on a presumptive understanding of disease dynamics, ability of the schools to handle it, the understanding that children don't get severe disease. We've gone through our delta already in the second wave. We are, I think, in a stage to take a minimal risk and do this. Now, last point is parents. Parents are a different thing. It's a very, very individual decision. Where there is online, people are reluctant. Where there is no online and there is an additional incentive of going to school, like camaraderie, mixing, or even for that matter, the meal, it's happening much easier. This will be a varied spectrum depending on the confidence of the people to send their kids to school.
Yeah, and I think it would obviously change in terms of which area it is, right? Of course, in the urban place, it would be way different than how people react in a rural state. So these are the things that would, have an effect in terms of personal decisions. And at the end of the day, it does come to, like you said, the parents deciding for the children and what's best. And the scare is actually real, right? Even when in terms of the vaccine first came out, the vaccine scare was a thing that was in everyone's mind. So do you think that since we've spoken about the parents, do you think that this vaccine or this is going to be the same response for it this time?
You mean the question again
The
is
vaccine
exactly
scare was real
just repeat the question?
when it initially came out as well. The
Yeah.
vaccine scare was real, right? A lot of people were hesitant in terms of taking the vaccine. So do you think that we will have the same response when it comes to the Zydus Cadila?
Yeah, to so slightly answer it in a longish way, dial back to January, February, March, people were talking about which vaccine, why should I take, COVID is not going to come. Come April, when COVID hits us in our underbellies like never before, people were scrambling for the vaccine. The
Correct.
trial was ending for us also, and people are asking for the trial vaccine also, not knowing whether they're going to get the vaccine or the placebo. So I think it's a question of now people understand much more. At least if you look at India in particular, the vaccine hesitancy, refusals have been lower compared to other parts of the world. The
Right.
developed nations, the US, North America for that matter, and other areas have been very problematic when it comes to getting compliance. We've been very good relatively, we feel. And
Yeah.
similarly, the 12 to 18 population, in my opinion, should not have such a problem. The major problem is in the youngest age group, where you need to show, all the safety and the efficacy, more safety than efficacy. But I think 12 to 18 will not find much difficulty in accepting it. On a personal note, for example, if I have a 16-year-old, I'm very happy to say, please get vaccinated so that we can move on with life in a
Yeah.
more regimented fashion with an extra degree of protection above and beyond what we already discussed.
Correct. And also because these are young adults, right? And most of their youth, if you think about it, for the last 2 years have been missed out by just sitting at home. So the entire thing of going back to school or normalcy for them is a lot more different than what other people would perceive it like. So and I think we've had a good discussion in terms of what the vaccine was, and a lot of like other questions which also got us to understand your thought process. But I want to ask you a question which I think most people would be interested to know about, which is, what is the estimate price of this vaccine?
So nobody knows. I think I'm speaking for the company if I do that, and I think they are struggling with that because
Okay.
there is need and there is market dynamics. So I think that's
Right.
something we'll never know. We know that the current vaccines go from 700 to 12, 1300 if you look at the three current variants. So we are
Right.
also curious to see see at what cost do they market this vaccine ultimately. Their USP seems to be the 12 to 18 age group. That's an
Okay.
advantageous. The second advantage seems to be that the trials were done in the time when the second wave was there, the Delta period. So they are
Right.
claiming a significant efficacy for the Delta variant also, which you brought up earlier. So with
Yeah.
that, what will they price it at and how will be the penetration, the acceptance is a matter of conjecture at this point.
Okay. So, but if you could give us like a brief idea in terms of when it would be announced so that we, are sort of like ready for it.
So again, not privy to that, but the idea I got was that by October end or so, it should be ready to hit the market literally.
The
So
market.
obviously,
Okay.
pricing would be essential part of that. So we're looking at anytime. I think this is going to happen. It's also a
Yeah.
question of their stocks, I'm sure. What is the production level and so on. Practical issues which will get sorted out shortly, I'm sure.
Right. So I think we're doing this interview at the right time for people to actually understand what the Zydus Cadila vaccine is about. And if there was any scare, to not be that apprehensive, because, at the end of the day, like we spoke about, there are so many vaccines in the market, and this is just another option that has come in. And in fact, it's even better because it's for the adolescents to step into the new normal. So with this, I'd like to wrap it up with my last question to you, which is that now, relatively compared to how it was with March 2020 or even with the second wave, the pandemic seems to be under control. But if you would have to leave our audience with a take on what are the precautions that we need to take now in terms to get back to normalcy, or what we term as the new normal, what would be your take on it?
So the two ways of looking at it, it's a great time because despite the amazing opening up of society in general and the work in particular, we don't have escalating COVID numbers. So it's a great time. On the other hand, when you just look a little beyond and see the other nations of the world, you can see the problems they're facing when they're not doing what's supposed to be done. So I
Right.
always use this yogi paraphrase. It ain't done till it's done, which ultimately means that until we
Yeah.
cross the point of knowing that no variants are coming, our vaccines are working, we have tested normalcy or the new normalcy as much as we can, we won't know. So the
Right.
two things which come to mind immediately are stay aware of your surroundings, know that this is not gone. Secondly, vaccination, which has been espoused enough in a million times, I think, in all sorts of proclamation. And lastly, we still cannot say goodbye to the mask and the precaution. So
Mhm.
infernal as the mask, maybe it is still essential. So we'll still have to hold on to it till we get a clear signal that it's done.
Correct. Okay, and I think you pretty much answered even the questions that I had in mind and I wanted to ask you about, and I'm pretty sure that that would answer most of the audience's questions as well. If you have some parting notes, you could also say that, and then we can wrap up.
No, I think we're good. All we can say is that it's lovely now compared to what we've seen. But the what we have gone through is something which most of us or all of us have never seen in a lifetime.
Right.
So lessons remembered are lessons learned. I think we just have to make sure that we embrace what we like, at the same time have a cautious watch for what is around the corner. And I think as a society functioning as a whole together, with both healthcare, civil society, media, and everyone is the need of the hour for COVID-19. If that happens, I'm sure despite the bumps in the road, we will traverse this and there is definitely not only light, but a bright sun waiting for us at the end of the tunnel.
Yes, and thank you for ending this actually with a positive note, because I'm sure everyone wanted to hear this. So thank you so much, Dr. Ravindra Mehta, for taking your time out from your busy schedule and answering all of our questions. And we'd love to do this again soon. Thank you.
Thanks a lot. Have a lovely day.
Yeah, you too. So this was Dr. Ravindra Mehta, and I'm Gurdana Simran. Don't forget to like, share, and subscribe to Salar if you like this interview.